Hi, I'm Dr. Imran Khan, Consultant General in Medicine at Care Hospital, Mushirabad, telling you about how to treat diabetes. First thing, lifestyle modification to be done for every diabetic patient. The most important thing is to be active or exercise. So, what kind of exercise we should do for a diabetic patient? The first important thing is aerobic exercise. Aerobic exercise like walking or cycling, it should be done at least 150 minutes in a week or 30 minutes in a day, at least 5 days a week, 4 to 5 days a week. That will be helpful. This is first is aerobic exercise. Second type of exercise they should go for is a resistance exercise. They can have moderate weightlifting, or they can go to the gym. That will help in the health of muscles and bones. And the aerobic exercise will help in the decreasing weight, regulating blood sugar, will have very good impact on the health of heart also, and may be helpful for the regulation of the blood pressure also. So the aerobic exercise, second is the resistance exercise, and last one is the stretching exercise. Stretching exercise will help, like yoga, will help in the improvement in the health of ligaments and bones and joints of the diabetic patient. These are the exercises to be done. Then second thing in the lifestyle is low carbohydrate diet, low fat diet. Try to use complex carbohydrate like whole wheat flour, brown rice, various vegetables, basically non-starchy vegetables like broccoli, leafy vegetables. Avoid potato in vegetables. You can have lots of salads and all these things, and avoid completely the sugar, the refined sugar. Completely avoid the refined sugar. A moderate intake of meat. You can have chicken, fish, eggs in a diabetic patient. These are the brief about the diet. So the exercise, second is diet. This is about the lifestyle modification in the diabetic patient. Second thing comes the medicines. First is insulin. In some patient we have to start insulin, like type 1 diabetes or type 2 diabetic patient where the drugs or the oral medications have failed. We have to start insulin. Second thing in the medication is tablets. The oral medication. There are few different types of the oral medication available. One class of the medication will decrease blood sugar by increasing the insulin secretion from pancreas. Second class of the medicine will help in decreasing the release of glucose from liver. Third class of medicine will decrease the absorption of glucose from gut. Fourth class of medicine helps in excretion of sugar in the urine and decreasing the blood, indirectly decreasing the blood sugar level. And few drugs are there which help in the modulation of action of insulin on our cells by decreasing the insulin resistance. These are the basic classes of the how this oral glucose lowering agents works. We may need to give one medicine, or we need to use a combination of medicine while treating the diabetes. Right? This is how we manage. And the last thing is, whenever the diabetic patient have some infection or some complication, visit your doctor. There, in that period of the time of infection, if it is mild, we may need to alter your medication, decrease your doses of oral medication, or sometime if the infection is moderate to severe, sometime we need to shift to the short acting insulin or admit the patient, right? So this is about the brief about management of the diabetes.